This is Dr. Eric Fishman with EHR-TV at HIMSS 2012, and I have the pleasure of speaking with Sanyal, CEO of T-System. Sunny, it's an honor to have you here, and I thank you very much. If you've been in this industry, you've heard your name, you've been doing a lot of great things for very large companies, and for the last 2 years you've been at the helm of T-System, obviously the premier place in the emergency department. Tell me what made you decide to move to T-System.
Yeah, absolutely. So first and foremost, I've been in the healthcare IT space for 23 years, and each year has been more exciting than the previous year. And as I looked at my career and as I looked at where the industry's headed, what I realized was that there's a tremendous amount of opportunities with electronic medical records in the emergency medicine. One, emergency medicine overall was behind in terms of adoption, behind the curve in terms of the use of clinical documentation systems. But secondly, it's a very important hub for care delivery. And frankly, all of us are motivated by how we impact healthcare. And then when I see the thing that T-System can do, a company like T-System, we feel like we make a tremendous impact in the delivery of care delivery through emergency medicine and through the use of systems, improve the way patients are taken care of in the ED setting. So I decided to come out of a big company and join a small company like T-System, where I can have a personal impact and where we can make a big impact in medicine.
And T-System must be doing something right. They've got over 40% of the market share, I understand. What do you think some of the features and functionality are that make it so pervasive in the ED?
So T-System was founded by 2 ED physicians, and they came at it from the perspective they wanted to make their lives easier. So as physicians, they knew exactly what they wanted to be able to take care of their patients, to go home on time, and be able to document what they did during the day, and so that they can get paid accurately for their work. It was that simple. And so they came up with a technology that was very simplistic, that pretty much allowed them to capture everything that they did during the care delivery process without having to spend extra time. So they focused very, very heavily on the ergonomics, on the human factors elements of electronic documentation system. So they developed a system that was very fast, very quick, very simple, and efficient for the physician to use, that made sure that they would be able to build code correctly, build correctly, and at the same time have all the necessary regulatory information captured and have it be comprehensive and accurate so it can stand up in case of a litigation.
How is the documentation accomplished? Is it point and click? Is it handwriting? Is it speech recognition? Is it a combination?
So it's all of the above, but basically all the clinical knowledge of everything that goes on in an emergency room is organized by what we call as chief complaints.
Right.
So there are 58 chief complaints, and everything that can possibly happen in an ED, and all the care processes that are needed to take care of patients are organized around these chief complaints. And so what the founders did was created a workflow paradigm and a user interface paradigm where you circle something if it's a positive indicator, you put a backslash on something, it's a negative indicator. So it's a combination of circles and backslashes, and the whole premise was you shouldn't have to click more than 2 times or 3 times to get to something. You should be able to do everything you need with 1 click. So the whole user interface was designed for speed, efficiency, and accuracy. All you do is simple check marks and backslashes to capture what you're doing.
As we were discussing, slowing down even for a minute can be a tremendous issue in
Absolutely.
the ED.
And ED goes in, the patient volume in an ED comes in bursts.
Right.
So 1 minute you're mobbed, and the next minute it's a little, you're free. But you have to design a system for that high activity period. So you want to make it as efficient, as quick as possible.
Now obviously the ED is not the place that most people, for their preferred location for care, they need to get information to be brought in. And so what mechanisms, what utilities do you have to bring information from the outside world into the cloud?
Yeah, so when someone comes into the ED, the system...
And they have a primary care physicians, and it's 9 to 5, Monday through Friday,
yes.
And so they have lab data, they have images. How does it get brought into the system?
Yeah, so when a patient shows up in the ED, we're able to, first of all, through the registration process, their basic demographic information is captured and comes into the ED. If they've already been there before, so that information's already there. If there are patients' medical records available in other parts of the healthcare delivery system, we can integrate with those systems to bring back in that information, like lab information, prior visit information.
And that's if the information is in a data format in fields. Suppose it's a PDF, a scanned image of something. Do you have mechanisms of importing that type of data into data fields?
Absolutely. So information is available either in the form of films or it may not be digital images, might be films, it might be in the form of paper documents. We can scan external documents into our system and bring them into our system. If the patient's had a previous history of medications fulfilled from in the outpatient setting, we can import that into our systems by querying those external systems. So there are many ways of bringing information into the ED when the patient comes in.
And now let's talk about the opposite of that. There are some new announcements about the continuity of care, of getting the handoff, because the ED is not the final place of care for most folks, and they're going to go to see a specialist, their internal medicine physician. Tell me about that new product suite.
Absolutely. So the patients, like you said, they don't come into the ED as a destination. They're there to transition to some other place, and that some other place might be their home, might be might be an admission to a hospital, might be to a skilled nursing facility. So the information has to flow with the patient. So what we do is, first of all, when a patient comes in, if they have a primary care physician, we can inform the primary care physician that their patient just showed up in the ED.
And that's an electronic?
That's an electronic message form. When the patient's in the ED, the primary care physician can see that they're in the ED, and they can have access to some of the preliminary reports from the ED.
Any telemedicine capabilities?
Yes and no, in that it's not something we natively offer, but if they wanted to use Skype, they could absolutely hook that up into our system. But the key here is that we can engage the patient's care delivery team. So if they're the physician, the specialist, the care coordinator, can all be engaged. When the patient is discharged, the information from the ED, the reports, can be sent to the primary care physician. If they don't have a primary care physician, we can assign them one. The hospital can set it up that way. If they want it, the hospital sometimes will use these systems to then organize a follow-up visit with that primary care physician or with the specialist. And all of this facilitates that transition of care for that patient. What you want is a warm handoff of that patient to another caregiver. In a previous paradigm was you just discharge them to the curbside, and then you don't know what happens to the patient after that. That's not acceptable. What the industry is looking for is a way to have a full closed loop care continuity system, and our technology facilitates that.
It's good to have you do that. That was last month's announcement. Tell me what you're envisioning in the next 6 to 12 months.
What we're envisioning is that we'll continue to evolve around our capabilities in the ED itself. So we will continue to provide functionality that helps physicians, clinicians, nurses become more efficient and be able to take care of patients more effectively. You'll see more decision support capabilities coming from T-System. But then also equally, what we want to do is provide the entire solutions that help both physicians and hospitals maximize their throughput and revenue cycle capabilities. So from the point where a patient walks into the ED or is brought into the ED to the point where money is collected, you'll see solutions from T-System that takes care of the entire supply chain. Secondly, it's very important for hospitals in the future. If you look forward, let's say a couple of turns, whether or not ACOs manifest themselves in the way it's envisioned, there's still a very big need to maintain for hospitals to keep patients within their referral network. So you'll see us continue to evolve and develop solutions that helps us provide care coordination services for the patient. There are a variety of clinical services that also are important, and T-System will, over time, build on this current platform of continuity to provide the services like follow-ups, like medication compliance, like ensuring that the patients have access to their caregivers, have access to their information. So we'll continue to evolve along those lines.
Sunny, this is an exciting time to be in this industry, and I can tell just by your voice how excited you are about it.
It is a very exciting time to be in the industry. You know, our employees want to make a difference. Everyone wants to change healthcare, but I believe the people that can change healthcare are the ones that are a part of the healthcare system. If we see our systems handle over close to 40 million patients a year, we think we can touch the lives of 40 million patients, and that's what excites us.
Sunny, thank you very much.
Thank you.
Appreciate it. This is Dr. Eric Fishman with EHR TV. We've had the pleasure of speaking with Sunny Sanyal, CEO of T-System. Thank you.